man, are you going to the rave this weekend?
Yes, I can't wait. I'm so excited.
Yeah, it should be fun. Are you gonna take Molly?
Yeah, I'm planning on it.
Wait, but aren't you on an antidepressant? I've heard that antidepressants can cause some problems when you take Molly.
No, don't worry. I'm just gonna take more. I think if I take more, I'll feel it a little bit better.
Oh, okay, I guess that makes sense. But can't that be a little bit dangerous? I feel like you're gonna get really, really sad after you're done.
No, I'm just gonna take this thing called 5-HTP. If I take 5-HTP, then it'll replenish my serotonin and I won't feel as sad after.
Stop. Though she may not know it yet, this young woman is putting herself at extremely high risk for serotonin syndrome. Serotonin syndrome occurs when there is too much serotonin in the body. It is usually caused when you take 2 or more medications that affect your body's serotonin levels. These drugs can include antidepressants, like selective serotonin reuptake inhibitors or monoamine oxidase inhibitors, supplements, like 5-HTP or St. John's wort, certain types of painkillers or cough medications, and recreational drugs like MDMA or ecstasy, LSD, or stimulants like cocaine. According to the American Association of Poison Control Centers Toxic Exposure Surveillance System, in 2004, 8,187 people were diagnosed with serotonin syndrome due to an SSRI, and of those cases, 103 were fatal. Symptoms of serotonin syndrome include agitation or restlessness, abnormal eye movements, diarrhea, irregular or fast heartbeat, increased body temperature, high blood pressure, rapid blood pressure changes, nausea and vomiting, hallucinations, muscle twitches, loss of coordination, or overactive reflexes. If you are on a medication that affects your serotonin levels and are experiencing multiple symptoms, you should seek medical care immediately. Your doctor will perform many tests to rule out other causes, as these symptoms may be caused by many different things. It is important you be honest with your doctor about the medications, supplements, and drugs you have been taking. Tests may include blood cultures, toxicology screenings, electrocardiograms, and kidney and liver function tests. After being diagnosed with serotonin syndrome, you will most likely be kept in the hospital overnight for close observation. Treatment may include intravenous fluids, cyproheptadine to block serotonin production, benzodiazepines to treat agitation, tremors, and muscle stiffness, and discontinuation of the drugs that cause the syndrome. It is important to seek treatment because serotonin syndrome is very dangerous and potentially life-threatening. If left untreated, serotonin syndrome can cause seizures, severe muscle breakdown, kidney failure, coma, and potentially death. But it doesn't have to be this way. To prevent serotonin syndrome, always be honest with your healthcare provider about the medications and drugs you are taking. If you are currently on an SSRI or another drug that affects your serotonin levels, do your research about which medications and supplements are right for you. And if you are unsure, always ask your physician. Now let's get back to our scenario, knowing what we do now about serotonin syndrome.
Hey man, are you going to the rave this weekend?
Yeah, I'm so excited. It's gonna be so much fun.
Yeah, it should be fun. Are you gonna roll?
No, I take an SSRI, so it's not that safe for me to take drugs like Molly or ecstasy. I'll probably just drink a little bit and watch you guys have fun, but be safe.
Oh, okay, that makes sense. Thanks for looking out for us.
Information for this PSA was provided by medlineplus.gov, the American Association of Poison Control Centers Toxic Exposure Surveillance System, Pharmacology, Drugs, the Brain and Behavior by J.S. Meyer and L.F. Quenzer, special acknowledgements to Dr. Ashley Lewis and Psych 433 Psychopharmacology at Chapman University. Always remember, be smart, do your research, and above all else, talk to your doctor.